And please, doing wrist extensions, that's not enough, all right? That won't fix your problem in the long term. What's up guys, my name is PT Philip. Today we're going to cover the topic of tennis elbow injury. So if you have pain right here on the outer part of your elbow, this is the video for you. Alright, let's break this down real quick. If you have pain right here on the inner part of your elbow, the medial part, that injury is called golfer's elbow, and you should go over here and watch this video where I explain what happens if you have pain here. But today we'll cover the topic of pain on the lateral side of the elbow. What happens is, when you have lateral pain on the elbow right here, the tennis elbow injury, this is an inflammation injury. Your tendons are the structures that actually attach the muscle, the meaty part right here, to the bone itself. And when those tendons, when they get overused, you get inflammation in this area, and that inflammation is actually your body signaling your brain that something is off over here and that you need to change something. And as always, I'm going to show you how to treat the cause and not the symptom, because there are multiple causes for you to have pain over here, and the philosophy is always to treat the cause and not the symptom. Symptom can relieve you of some pain, but it won't fix the problem in the long term. And please, doing wrist extensions, that's not enough, all right? That won't fix your problem in the long term. So we need to take a closer look at this injury from different angles, all right? So let's dive in. All right, so you can do this test on your own and figure out if you truly have the tennis elbow problem. So I'm going to show you a Mills test that you can use for diagnosis purposes. And basically, you're going to flex your elbow like this. You're going to pronate your wrist, and you're going to flex that wrist, all right? And now you're going to find that lateral part of the elbow, and you're going to do a full extension in the elbow while palpating the area right here. And during this movement, if the test is positive, if you have pain in the lateral part of your elbow. So after you've done the test, let's talk about the most important thing, and that is the causes of tennis elbow pain. All right, let's talk about the most important thing, and that is the cause. If you figure out the cause, you can stop that, and that will prevent the injury happening in the future, and that is exactly what you want to do. So when we talk about pain in the lateral part, we gotta think about the muscles that are right here in the forearm. We have the flexors that do this movement, that flex the wrist, and we have the extensors that are right here on the lateral part that extend the wrist, obviously. All right, so using common sense and logic, we can figure out what is going on here. All right, to flex my wrist from this position, it's gonna take me to do this. And my flexors can produce a certain amount of power. But if my flexors are too weak, how can I make this movement stronger? Well, I can extend my wrist, I can preload my extensors, so my flexors have more time and bigger movement to produce more force. And what happens is, your extensors, they need to do the work of the flexors. So this is probably the main cause of your problem. Your flexors in your forearm that should supposed to do this, that flex the wrist, are too weak, all right? You need to make them strong. The second cause, your shoulder, the humerus bone, it goes right here into your elbow, all right? And what happens? If you have bad shoulder posture, check out this video right here. But if you have bad shoulder posture, your shoulder will rotate inwards. Your wrist will also rotate inwards, as well as your forearm. What happens when my arm is rotated this way? My extensors are overstretched. If this happens throughout a longer period of time, you will get pain over here, because these tendons right here, the extensor tendons, are overstretched, and that will cause the pain. And the third cause is a little bit more specific. So if you are practicing combat sports, if you are throwing punches, if you are playing baseball, for example, or any sport that involves throwing, and if your shoulder blade is weak, the shoulder blade right here should decelerate your arm when you throw. So the shoulder blade should stop you right over here. If the shoulder blade is too weak, your extensors will take over that work as well, and you will get the overuse injury in them as well. So maybe before treating your outer elbow pain directly, you should think of bad shoulder posture, weak forearm flexors, and weak shoulder blades, all right? The second thing that you can do is you can obviously treat the symptom, and you can relieve yourself of that pain a little bit. As I said, it's an inflammation, so the only thing we can do is we want to reduce that inflammation. We can do that by putting ice on the affected area. You can take a plastic cup or a paper cup and fill it with water, put it in the refrigerator overnight, and you can peel off the top part of that plastic cup, and you will have a great tool for cryotherapy. Also, you can do the cross friction massage. So use these two fingers, your muscle fibers on your forearm, they run this way, so you can do cross friction massage, and this will really help release some of that tension that you have in your elbow. And the third thing is obviously you can use a brace of some sort that will put a little bit of compression, and that can also ease up the pain. But now I'm going to show you a couple of different exercises that you can do in order to treat the symptom and get that elbow back in shape. Alright, so the first thing that you can do is you can basically use gravity as a self-mobilization technique, and you can do a little adjustment in your elbow just by using gravity. So basically you're going to flex your elbow right here, and you're going to let the gravity do the work, and basically let your forearm drop to the floor like this. All right, and you can really try to relax this area right here, and I felt it right now. If you feel a little pop over here, great, you just did a little self-adjustment, and that self-adjustment can really ease up that pain. The second thing you can do is you can do a little stretch for the extensors right here. The same thing, we're going to bend the elbow, so we're going to flex the elbow, but now we're going to use the other arm, and we're going to flex the wrist right here, and we're going to rotate it to that side, and we're going to dose it with our other arm. So with this arm, I am dosing how much and where I feel comfortable, and right here, I can feel a little stretch over here, and that is exactly where you want to hold this position, and hold it for as long as it feels good. All right, hopefully you can see me. So you're going to need a wall edge right here. You're going to lean your shoulder and your upper arm to the wall, and you're going to have your forearm and your elbow in front of the wall, all right? You're going to lean to the wall. You're going to use your other arm and you're going to open your fingers like this, and you're going to push the elbow this way, and you're going to perform the squeezing motion right here. And I want you to do pressure on, pressure off technique. So you're going to put the pressure on the elbow a bit for a couple of seconds, and then you're going to release, and then you're going to repeat. And this exercise is great to dump tension from this area right here. So you're basically leaning to the side, you're putting a little bit pressure here, you are squeezing, and you're doing the pressure on, pressure off technique. And for the last move, yes, we are going to do some extensions, some forearm extensions, but as I said, doing just the forearm extensions is not enough. You have to treat the cause and not the symptom, all right? So what are you going to do? You're going to grab a band, resistance band right here, and now you're going to you're going to grab it this way. You're going to use the other arm to fully extend your wrist, and now you're going to do eccentric contractions lowering the band. Now this is a little bit too loose for me, so I can make it a little bit harder this way. Let's say right here, and I'm going to use my other arm to pull the band to full extension, and now slowly I'm going to do the eccentric curl. And as I told you many times, eccentric curls are great corrective exercises as well as strengthening exercises. So when it comes to wrist extensions, I would rather for you to do the eccentric curls than just to flap around your wrist up and down. Alright guys, to quickly recap, I told you how to treat the cause, and that is the most important thing. Afterwards, I showed you a couple of exercises and stretches that you can do to treat the symptom. The main thing is, this is the inflammation injury, so it's going to take you anywhere from 5 to 15 weeks to really reduce that inflammation and to stop it from reoccurring in the future, because the last thing you want to do is to fix it and then get injured again and again. And I'm having that problem with the golfer's elbow, and I don't want you to have that same issue with the tennis elbow, alright? The main thing is, you don't need to be a tennis player to have pain on the outer part of your elbow. Anyways guys, hopefully this video was helpful. Please give it a like button if it was. My name is PT Philip. I'll see you at the next video. Take care and bye bye.